Hi everyone, my name is Christine, and the country I'm going to present to you guys is Cameroon, and the health issue they're dealing is child mortality. So a little bit about Cameroon is it's located in Africa right here, which is in orange. It's located in western central Africa near the South Atlantic Ocean, and the capital is Yaoundé, and the population is 23.5 million people. And it is actually a fairly new country because it was created in 1961 by the French and British colony. Therefore, the official language is French and English, known as Miniature Africa, due to the large diversity of environment contributes to geographical and cultural diversity. So, we're going to talk about the disparities in social determinants of health. So, some of the determinants are socioeconomic, so polygamy, which is very common in rural areas, where multiple women are committed to a relationship with the man, and education. So there's a lack of resources because not everyone, especially for women, are educated, and there's actually were numbers where women, or not women, excuse me, men were educated, also having more jobs, and we see that women, there's small percentage of women are working and have jobs, and many of them, and the majority of them of women are not working because of the education they did not receive, or they actually quit school early. And another determinant is environment. So women in rural areas do not receive the care they need due to the lack of healthcare facilities in those areas, whereas women in urban areas are more likely to get the care they need. And I'll explain that later on. And so this shortage of healthcare professionals actually happened due to an economic crisis from the 1980s to 1990s, and that led to healthcare professionals not working. And when they do, if those professionals are working, they would often work in poor environments. They're not getting paid, and there's not they cannot get promoted like any normal healthcare facility would, and also the outdated medical practices and equipment. If they don't have the utmost update medical practices, therefore pregnant women, and newborns and children, young children, are not able to get get, get the care they need. So the cultural issues and stressors are gender equality towards women, of course. So women are more likely to be sexually abused due to violence, especially. And another, and to tie in that, is working or women circumcision. So this procedure is actually very common in Cameroon because it's also, if women are doing this procedure, it means that they're faithful to their husbands, and they'll be respected. If they do not do this procedure, they'll be viewed as promiscuous. And another thing about Cameroon is that polygamy is legal, and the reason why it's an issue because women that are committed to those relationships, they actually are not the only they're mainly are married due to the financial stability, and they're only working in their homes, and they don't get to do much when they're married in a polygamy relationship, which cause tensions, especially if there's multiple people in the relationship, which is why I listed polygamy as a problem in the country. And so the vulnerabilities and health risks in Cameroon is under 5 mortality rate is 136 per thousand per live birth. Neonatal mortality is 31 per thousand live birth. And lastly, infant mortality rate is 85 per thousand live birth. And so some of the death complication children, newborns would die from are preterm birth inflaxia, and neonatal sepsis. And on to psychological and mental illness. In Cameroon, they don't really talk about or have an open discussion about mental health because it's very stigmatized. And I mean, it's been very stigmatized for many countries. And till this day, Cameroon view mental as a negative, like a bad thing. And I found when I was finding research for my paper, there was not actually many research on people with mental health because we don't, like I said, don't have enough open discussions. And also this will lead to high rates of depression and suicide. And a bit about abortion. Abortion is a very strict law in Cameroon, and the only women that can are only able to get abortions are women are if their health is at risk, if they were raped, and to prevent any physical trauma and mental trauma as well. And the model that I used for this program was the Health Communication Program Cycle. A little bit about the model is it's a four step program where a group of people or organization organizes, and they would plan a program to prevent a or reduce the healthcare issue. And so for my main goal was to reduce the rates and prevent child mortality by using traditional medicine uh, due to many people are using it. And so the four steps includes planning, developing messages and materials, implement a plan, address the effectiveness of the program, and making any changes. And so what I found when other researchers use it is actually the government of Cameroon actually launched a multi-sectional program several years ago to reduce maternal and child mortality by working with public sectors. And so the reason why they want to do this is because they want to recognize this issue not only in Cameroon but also internationally. And they also mentioned that health offering health service would not be the solution, but by working with other sectors, able to access healthcare, also how much money they're going to spend, so budgeting, coordinate plans, how to prevent it, and their goal was to reduce maternal and child mortality by 25% in 5 years. Like I briefly mentioned about alternative medicine is very common. The reason why it's very common is because how easy it is and how cheap it is. Because getting prescriptions is very expensive, and getting those prescriptions are not easy to get. And one thing about alternative medicine is that Cameroon actually have over 8,000 plant species across the nation, and some of them were treated to treat infections, cancer, pregnancy, tuberculosis, and diabetes in children. And some of the plants are consumed by a form of deconcoction, which is um, boiling boiling it or heating the herbs, and so which is way this is how people consume it. Another one is this concoction, is where mixing the herbs together, which create this special medicine for certain purposes. And lastly, powder. And some of the spiritual beliefs and morals is the three major religions are practiced in Cameroon. First one is Christianity, which is 70% of the population are Roman Catholic, Christians, Protestants, and others. Second one is 20% of population are Muslim, which belongs to Islam. Lastly, African folk religion is actually um, is I would say common, but there's a certain percentage of people actually still practicing it till this day, which is originally from a which was passed on from the ancestors. And so the moral values are guided by the religion they practice. So Christians would use the Bible, Muslim would use the Quran, and African folk religion actually rely on stories that were passed down from their ancestors. And healers mostly practice in rural areas, and due to medical advancement in urban areas, since there's due to the lack of healthcare facilities, healers actually would take those places and specialize in treating illnesses. So with herbs, so with the many of the plants they use, and medicinal plants, and some of them actually we can do witchcraft, and which I will also include in my program. Some of the institution of health consists of private and public entities and organizations that provide health service. So hospitals that are public and private. Also, another thing is private. You would have to pay more money to them, and let's say you need to go to hospital because of a broken arm, you actually have to pay more money to actually get it everything checked and fixed compared to a public, which is more affordable, and also clinics. And also rural areas also lack of healthcare facilities, and the Ministry of Public Health provides public health service, and it's more affordable than private sectors. And the goal is to provide universal healthcare by 2035 for everyone, because not everyone in Cameroon have insurance. Another one is healers, like I briefly mentioned. There are many of them are spread out the country, but mostly in rural areas. So I'll break it down the 4 steps of the health communication program cycle. So the first step is to find ways find the problems of child mortality. So pregnant women and mothers, and recruiting with doctors and physicians and many other people, and also healers as well. The second step is finding materials that will be helpful for everyone to understand. So let's say also health literacy. It's very important for everyone to understand what's going on in terms of health, which is why I wanted to include medical professionals that are also translators, because it would be more easier for them to communicate rather than having a third party who is just only a translator and communicating with the doctor and the patient. Therefore, I would actually prefer having someone in the medical field are also translators are in fluent languages. So since Cameroon speaks French and English, and also other languages as well. And also finding physician healers will be helpful that are willing to be involved with this program. So the third step is to promote child mortality in the country through presentations to Cameroons in urban and rural areas, and also panels where physician and traditional healers can talk about their concerns and questions, and there'll be Cameroonians from different areas will also talk about their concerns and questions about it. The last step is to make any changes if needed, and the program will also be monitored by the Ministry of Cameroon, and they'll be also monitoring the increase or the decrease of child mortality over the years. My references. So thank you for watching and listening.